Hi, I'm Lori Jo Vest, and I am here today with Gaby from Mile High Denture and Implant Centers. So, if you go to Mile High, you may end up working directly with Gaby. And
Mhm.
Gaby, tell us what you do.
So I am the treatment coordinator here. I basically work beside Dr. Cable. When patients come in for their new patient exam, I meet with them first, and I basically have a conversation with them about what brings them in today and the reasoning for the consult, and then so it's basically like a small interview, just building rapport with the patient. Um, and then, we get started with 3D imaging, x-rays, panoramic x-ray, and then we head over to the clinical room, and Dr. Cable then comes in, takes a look clinically, and then, goes over the 3D imaging with the patient, and we'll go over the recommendations and what the patients are candidates for.
Now, you're basically the first person they're going to meet with, and you kind of take them through that process, and you're kind of there like as to help guide them through it so they feel
Yes,
comfortable and they can ask you any questions that they have.
absolutely.
Wonderful. So what for those who are new and just maybe starting on their pathway to considering full arch dental implants, what are they? Cheers.
That's a really great question. Dentures are your conventional removable dentures, and then the fixed implants is called all-on-4 treatment. And the difference between them is that one of them is removable, and the all-on-4 is fixed. It's more of a permanent solution and closest thing to your natural teeth.
hmm
Mhm.
And you don't have the problems of them falling out,
Yeah,
having to take them out at
yeah,
night,
yeah.
all that stuff,
Yeah,
right?
and then you're able to eat. And another big thing is like the chewing capacity between, when you have your natural teeth, you're at 100% chewing capacity. When you
hmm
go down to, when you remove your teeth or have missing teeth, obviously your percentage drops. But when you get
hmm
conventional dentures, your chewing capacity goes down to about 15-20%. With a
Ooh.
fixed option of the all-on-4, that chewing capacity increases up to 85 to 90%. So again, it's the closest thing to having natural teeth.
hmm We often hear people the most, during their smile reveals and that appointment where they're getting that beautiful final smile, they're always saying they want to eat steak.
Yeah,
We hear
yeah,
steak.
yeah. Steak and like shrimp. Can we have corn on the cob? Just things that,
Yeah.
chewing nuts and things like that that they are limited or that they're unable to eat. When they are
Yeah.
having or experiencing their discomfort and pain and just dental issues.
Yeah. It can be really hard. I mean, it can be a disability not to be able to eat or speak correctly, depending on how your dentures are performing for you.
Mhm.
Now, Gabby, can you give us a description of the procedure and how it works?
Yes. So the day of surgery, let's say hypothetically speaking, we have a patient that's coming in for a full mouth restoration, and they're looking to get the dental implants or the double all-on-4. They would come in. So that would look like they come in the day of the procedure. It's going to be a surgical procedure, so they're going to be unable to eat or drink anything 8 hours
Mm,
before the surgery. And then the day of, that morning, it's usually first thing in the morning. The procedure, if it is a double, it takes about 3.5 hours for the procedure. Dr.
mhm,
Woodbeck, our oral surgeon, would be extracting all of the teeth, and then he would be placing the implants as well as bone grafting if it's necessary, which majority of the time it isn't part of the
mhm.
procedure. And then as the patient is waking up, Dr. Cable is taking position of the implants, and he's placing the temporary teeth that the patients are going to be in for about 3 to 4 months during the healing process.
Okay, got it. So basically they act as your natural teeth. I was surprised by how small they were.
Yeah,
When you look at them next to dentures, they're very small
yeah,
and they look so natural.
they,
It's really
yeah,
awesome.
they do. And, during their healing process or healing time, they are going to have to stick to a soft food diet. And basically, the
Mhm.
Dr. Cable tells the patients is that it's going to be a brittle picnic with fork and knife. If you're able to cut through it, then you can have it.
Got it.
Yeah,
Okay. Like that plastic knife. If you can cut it with a plastic knife, you can eat
you
it.
can eat it.
But
Yes.
until you get your permanent, then you can
Then you
jump into
can,
the
then you can
steak and the
have all the good
salads
stuff.
and
Yeah, for sure.
Got it. Now, can you walk us through step by step what happens during that free consultation?
So
Because one of the things we do on social media is we encourage people to sign up for that free consultation just to come in and see what the practice can do for them,
yeah, and
right?
to explore your options. So people,
Hmm.
the first thing is, I know there's a lot of patients who have animal anxiety
Yeah.
who are scared. They have traumatic experiences. That's why, they have the dental issues that they have because they might have had a very terrible, traumatic experience in the past that,
Hmm.
I've had patients that I met with that sat in the parking lot for 30 to 45 minutes
Oh,
before they entered the door and were completely
yeah.
shaking and nervous. And, they have lack of confidence or they're very embarrassed, ashamed because of the condition of their teeth. And the first thing that I like to do when I meet with the patients is just like them know that they're in a safe space to feel those. And it's
Hmm.
very valid for them to feel the way that they feel, that they're, nervous. And, there's been times where I've told the patients, like, let's take a deep breath or let's smell the roses and blow out the
Yeah.
candles and just, relaxing. It's easier said than done,
Yeah.
but you're in a safe space and Dr. Cable's been doing this for over 20 years. Our staff, Christine, our office manager, she's just so warming when the patients come in and just make them feel so comfortable. And,
Right.
that's the best, the number one thing that we prioritize is making sure that they feel comfortable because it's a scary situation for them, and
Yeah.
they get emotional in that moment.
I love that you're one of those people because you do have such a loving and caring way of being. And
Okay.
we hear that about the whole team at Mile High. We see it in the
Yeah.
reviews that come in that everybody always is very kind and very
Yeah.
understanding. And if you're scared, they're going to give you the comfort that you need to just calm down and get through
Yeah.
what you need to get through, right?
Yeah.
So I love that about this practice. I mean, I've seen it.
Yeah.
Anybody we've talked to and dealt with, it's always everybody's always very kind. So now let's talk about one of the difficult things to talk about when it comes to full arch dental implants is the cost. It can people think it should be less expensive or they don't know how they're going to pay for it. So can we talk a little bit about what the full arch dental implants all on four
Mhm.
cost for a patient? What variables come into play?
So that's a great question. It depends. There's the basic all on four, which means they have a bunch of missing teeth or they need teeth extracted, so bone grafting, and that's pretty much your straightforward basic all on
Easier
four. Yeah,
case,
it's
right?
easier.
Easier case,
And then
yeah.
we have the complex one or complex two, which that's a little bit it requires more block grafting because there's bone loss or let's just say that there isn't any bone or not enough bone on the upper arch. They will then have to use the zygomatic implants, which Peter Craig is one of the few oral surgeons in Colorado that does place the zygomatic implants. So we have patients where they were told they were candidates for an all-on-4 because of the bone loss that they've had, where that, they have on the upper arch, where we been able to help the patients because Dr. Woodegg is able to place those zygomatic implants. So that would be a more complicated case.
Yes.
Or, if they have big sinuses and they need sinus slits, like that involves a little bit more of a bigger surgery. So there's that cost difference that is going to be higher. So the cost for, let's just say, basic to complex, we're looking at anywhere from, like 50,000 and it could range up to 65,000 if it is a little bit more complicated and they need sinus lifts or, the zygomatic implants.
And the zygomatic implants, now those go higher up
Yes,
than the traditional, correct?
correct. So the
Okay.
traditional implants are just the implants when they use them for the all-on floor. They're placed in the bone,
In the
on the upper
jawbone, right?
arch. Yeah, and then for the zygomatic implants, they use the cheek bone to be able to, and they're like twice the size of implants, the regular
Got it.
implants. Mhm.
And I'm going to assume, and I'm pretty sure this is right, that the doctors that do that type of advanced surgery need more training. They have more experience. So that's what you find at Mile High.
Yes,
Is
and not only that, but Dr. Warwick is also MP. So he is, he's also the doctor. So he's able to focus and do these type of procedures and also know on the medical side that everything is going to be okay and that
Got
our
it.
patients are in the best hands and the best care. And they're going to be well taken care of with our doctors.
Wonderful. Now, let's talk about the materials. I know Mile High is one of the practices that uses the higher quality materials, so you're going to have less incidents of saying having that tooth break while you're on vacation,
Yeah.
right? Oh, it
Yeah.
happens. It
Yeah. And no, it
happens.
really does.
Yeah.
And that's when it tends to happen when you're all enjoying life on vacation and then something like that happens. But,
Oh.
the temporary, teeth are made out of a plastic material and the
Mhm.
finals that they get after around month 4, it could be 6 months, just depending on the healing of each patient. It
Mhm.
varies, but their finals are made of zirconia. So it is a stronger material and, it's supposed to last a very long time.
So let's talk about how patients are able to finance or pay for this treatment. Now, some insurance does cover it, correct?
Yeah, there is actually one great insurance that Blue Cross Blue Shield (PPO), and that is a medical insurance. And if we can prove that the it's medical necessity for them to have this procedure,
Mhm.
they don't cover the entire treatment, but they cover a huge portion because your average dental coverage, we look at there's coverages from $1,500 up to $5,000
Mhm.
towards the treatment, and just maximizing their annual max. Blue
Right.
Cross Blue Shield, however, since it is a medical insurance, they don't cover everything on there. But we've seen patients. Let's just say, for example, we've had a patient who needed the treatment at the whole for, let's say, 55,000, 54,000. We've seen patients with this coverage that everybody's is different, their out of pocket expense, but her they came out of pocket 20,000, and the
Mhm.
lowest that we've seen was about 3,500 out of pocket.
Okay.
So that is a huge deal considering, if you paid it a double, even if we're looking at
Mhm.
the 20,000, you're getting two arches basically for the price of one.
Mhm.
And it's huge. It's huge. And for the patients that do have and that have gotten the all-on-4 with the Blue Cross Blue Shield,
Mhm.
they're very happy to hear that, their out-of-pocket expenses is significantly lower than what they were originally quoted.
Absolutely. That's so I can't imagine how they wouldn't think
Mm-hmm.
that dentures and, the mouth issues would be a health concern,
Yeah.
and this solution works for so many people. We
Yeah.
see the happy faces of the
Yeah.
patients who come back a year later, right?
Yeah.
So how, besides the insurance, if insurance is not an option,
Mhm.
how do patients pay for this treatment?
So there's different ways you can. There's patients that are very few that are able to pay for the treatment up front and out of pocket, cash check. But we also have financing companies. So if they're unable to pay for it out of pocket, a lot of our patients are needing to get financing done, and so we work with several companies that finance the treatment. And one of the common things that we're seeing right now is the patient stacking the loans. So
Mm.
they're getting multiple loans from different companies, and then just figuring out their monthly payment when it's going to be combined. And they're just so eager to get this going. Majority of the time, you ask them how soon do you want to get this done, and they say
Mhm.
yesterday. So
Yes.
yeah, no, I'm happy that that's one of the things that have been able to work for our patients, and we've been able to help them with stacking the loans. They can also pull equity out of their homes.
Mhm.
There's also personal lending if they want to go with their credit union, or just moving forward with one of the financing companies that we have.
Mhm. And some people require a cosigner, but that
Yeah,
helps.
yeah,
If
that
you've got
helps.
a sister, a mom, somebody who's willing to support you in this effort and just give you that
Mhm.
extra added boost to your credit, your creditability, that
Yeah,
really helps too. So consider that, right?
yeah, no,
And yeah.
absolutely.
And so what credit score do people need to get considered for the financing with the partners?
But it depends on the companies. Each company is different. requirement for most of the companies is about 660 credit score. However, we did just partner up with Accept Care, and they've been able to help some of our patients that have a lower credit score. Where we've seen in the high 500s, where they're under 600 with their credit score, that they've been able to help. They do have higher interest rates and it require some sort of a down payment. But I'm happy to meet with anybody who is interested in exploring those financing options and see what options we can give you and how we can help you move forward.
Love that.
Yeah.
Love that. Is there anything else you'd like to say to someone considering getting dental implants, Gaby?
I would say, just come in. We would love the opportunity for you to give us a call and come to one of our locations, and we're going to take great care of you. If financing or money is an issue and you're not able to do the all on four, we have other options too. We are temporary replacement options. If you're in pain and discomfort and you're not ready to move forward with the all on four, let's get you in and get you started and stage your treatment, which means that, you can start initially with conventional dentures and then eventually move up into a snap-in denture, or start one arch at a time, there's those options too. So, just, have the courage to give us a call. I know that it takes a lot,
It does.
Be courageous and just give us a call and let's get you scheduled, and we'd love the opportunity to help you and enhance your overall health.
Yes, absolutely. Gaby, thank you so much for taking time out of your busy day,
Thank you.
helping patients to be with here on this Facebook Live.
Thank you.
We really appreciate it. And just know when you go into Mile High to get help, you're going to meet with somebody just as awesome as Gaby is.
Yeah.
And they are here to help you. They have got lots of different ways. Full arch dental implants, of course, are amazing. But if you are not quite ready for that yet, they do help with dentures and all the other things that Gaby mentioned. So that's what we have for you today, and we will see you again soon with another Facebook Live.
Sounds
Thanks
good.
again,
Have a good
Gaby.
day. Thank you. Bye-bye.
Take care.